He's been called a quack, a fraud, and a criminal. The government has tried to take away his medical license and throw him in jail, all because he has the key we've been looking for.
For the last 35 years, we have continuously been attacked and fighting for survival.
This is what we have to do for paradigm shifts, right?
That's right. The future of oncology will be to identify the genes which are causing the problem and treat these genes, not treat just the name.
I've been in remission for over 20 years.
Dr. Burzynski, you're a blessing.
We can get rid of some of the toughest cancers.
It's happening.
It can be done.
My name is Sergeant Rick Schiff. I'm an 11-year veteran of the San Francisco Police Department. What I'd like to talk to you about today is my now 7-year-old daughter. This is an identical twin. Her sister is now dead. Her sister, when she was 4 years old, Kristen, developed a highly malignant brain tumor that had spread throughout her spine and her brain. The doctors told us that we had really two options: take her home, let her die, or bring her in for massive dosages of chemo and radiation simultaneously. In either event, she was going to die. They were quite certain of that, and very quickly. Believing her only chance to be the standard route, we gave her the chemo and radiation. It burned her skull so bad she had second-degree burns and her hair never came back. To change her diapers, we had to wear rubber gloves because her urine was so toxic and it burned her. At the end of 6 months, miraculously, she survived the standard treatment, although there was a high expectation she wouldn't. She still had cancer. We were told, sorry, we've done everything we can. Now she's going to die, probably within a couple of months. My wife and I, choosing not to accept that, started reading. The first book I picked up, the 3rd chapter, discussed Dr. Burzynski. I have no doubt that he does what he does out of earnest belief that his medicine works. But it's well established by the FDA that it's non-toxic. We put her back on Burzynski's, by the way, at the objections of our doctors for some reason felt that it had failed her. We put her back on. Within 9 weeks, the tumor was completely gone. She died last July of neurological necrosis. Her brain fell apart from the radiation. The autopsy showed that she was completely cancer-free. Out of 52 cases of that disease ever, no one died cancer-free, just Chrissy. So she didn't die of a terminal illness. She died of my inability to care for her properly, and she died from bad advice. She died because there's a government institution that disseminates false information and is not looking out for the welfare of the people.
So how is it? Are you still fighting with the FDA?
Well, no. At this moment, we are enjoying working relationship with FDA. We are exchanging our correspondence. Basically, I think we are now talking mostly with the computers of FDA, but we are moving forward, so we are not fighting.
So have any of your drugs been approved by the FDA for the distribution and treatment?
Yes, one of them has been approved. It's a prescription medication, and we are now working to increase indication for this medication, means to spread to a larger number of cancer. And we are working on 2 other medications in final approval steps, which is phase 3 clinical trials.
So experts are telling us that there is a quantum shift happening with cancer therapy. Can you say more about what is happening now?
Absolutely. Well, the current approach to cancer was introduced a long time ago, about 170 years ago, by a great doctor whose name was Rudolf Virchow, and he introduced diagnosis of cancer by looking under the microscope. And since then, the doctors were asking, well, let's have pathology examination, look under the microscope, and put the label on cancer. This is the breast cancer, this is the lung cancer, this is cancer of the ovary, etc. And then once they did it, the government gave them instruction, treat everybody the same way, okay? Because everybody is the same. But now we realize that the cancer is caused by abnormal genes. There are a large number of abnormal genes in individual cancer, from about 40 to 650 abnormal genes. So if you don't identify what is causing cancer, and genes are causing cancer, you are not going to get rid of this, okay? So suddenly, there is a shift. Last year, FDA approved 2 medications to treat any type of cancer across the board in which there is a mutation of a single gene. Just going away from treating the label, well, breast cancer, lung cancer, whatever, they said treat any cancer possible in which you find mutation of single gene, because this medication works on this gene, and it works in about 90% certainty, okay? So that's a big shift. Very few doctors noticed this, but that's the beginning of the end of the previous approach. Now, in the future, we hope that the doctors will be treating genes which are causing cancer rather than the name of the cancer. And when they do it, they'll be able to cure cancer. And that's what I was trying to do for the many, many years. Well, basically, I introduced this into cancer treatment in 1976, and we were able to cure the first patient in 1977. But since then, we are developing, and our approach is to find which genes are causing cancer, treat these genes, get rid of the tumors, and get rid of abnormal genes which are causing cancer. Then the patient can be cured.
So this is an entire shift in the entire approach to the treatment of cancer. Rather than treating the effects, we are trying to move back toward an earlier domino that fell and treat the cause with much of a less toxifying effect all at the same time.
It's a big change.
Yeah.
It's the last thing, similar change happened is then when the antibiotics were introduced. Well, it took a long time. Dr. Fleming reported the discovery of penicillin, then for 10 years, very few people paid attention to it. Finally, you got a war, and they needed antibiotic to treat the wounds. But then they began to treat, well, infection of the wound, pneumonia, infection of the bladder, whatever. Ultimately, the good doctor realized, no, infections are not caused by bad spirits, by odors, they're caused by germs. Let's identify the germs, let's treat the germs. It took them a while to understand it. Finally, when they got it, and they got a good success, great success in the treatment of infections because they treated the germs.
Yes, well, cancer is a much more serious condition than the average infection that we deal with, and you are definitely approaching and addressing this from this most amazing perspective. So
this is very, very complex problem because in complex infection you may have combination of 2 germs, and you use combination of 2 to 3 antibiotics. In cancer, you have from 40 to 650 abnormal genes. So you need to find the right combination of the medication which cover these genes. Our medications, which I discovered, they cover 100 most important genes in any cancer. But this may not be enough. You may need to add some other medications to cover the genes which are not covered by our medications.
So is curative treatment possible for these terminal cancer patients when it is this serious? Is it able to be turned around?
Absolutely, and that's what we see in our practice. We see great people. They have perfect credentials. They graduated from the best medical facilities in the world, and they were told, go home, straight on your ways, because you may have 1 month of life left. They're coming to us from all over the world, and they would like to fight. So we identify the genes. We put together a program which will treat these genes, and you can see that the tumors are melting away even after 1 or 2 months. But that's not the end of the story. We would like to get rid of the tumors, and then we would like to get rid of mutated genes. And that's the next step, and it can be done. Once this is done, well, let's live happy ever after, okay? We have patients who are surviving over 30 years and who came to us with terminal cancer initially.
30 years.
Over 30 years. 35, I think it's a record. But
It's impressive.
yes.
It's incredibly impressive.
It's not just 1 year and you claim, oh, we cured this cancer. No. It's many, many years when they live cancer-free and they live normal life and they don't have any problem from adverse reactions of the medications or bad effect of cancer. So that's what I call cure.
They are cured.
Get rid of cancer, get rid of bad genes, live happy ever after, okay? Live normal life, okay?
You brought some scans with you.
Yes.
Let's take a look at those scans. Can
Sure.
you walk us through some of the results?
I'd be glad to, yes. Well, So these are the most recent results, for instance, this scan shows MRI, baseline MRI, which is on the left, of the patient who was diagnosed with glioblastoma, 51 years old lady who underwent surgery, radiation, chemotherapy. Unfortunately, the tumors came back. You see active tumor, which is shown as a white big spot, and also you see the rest of this, which is surrounding, which is dark area, which consists mostly of inflammation. So after about 4 weeks of treatment, you don't see this white fragment anymore, which means that active tumor is gone, okay?
In a month?
Yeah, in approximately a month, okay? It doesn't mean that the patient is cured, because we still have some microscopic. So
Sure,
she's still
certainly.
taking the treatment. I saw her yesterday. This is after the second month of treatment. She's doing great. So not sign of tumor. Then this is another patient who came to us from Korea. She also had surgery, radiation, chemotherapy. She also had experimental treatment. The tumor came back, and you see this wide, big spot, which is occupying something like a quarter of the brain, which is recurrent glioblastoma. Deadly disease, something like a couple of months life expectancy. After 4 weeks of treatment, it's gone. Okay, you don't see any of this, and continues to be gone.
So
okay.
with the traditional therapies, with chemo and radiation, and then a tumor returns,
There's
over what
nothing
time
available.
frame does it return?
Well,
Over what kind of a time frame?
Usually,
Would we expect it to return in this same kind of time frame?
Yes, usually it's coming back within something like 9 months, okay?
Okay.
After all of these treatments, sometimes after 4 months, okay? Maximum something like 14 months, okay? And then when it comes back, something like 80% of these people are dead within 6 months. Nothing really is available with standard
But
treatment.
you're seeing 6 months, 8 months, 10 years, 12
Yeah,
years,
that's correct.
19 years.
Yes, that's right. Living normal life. And now, since we have all of these other medications available, now we can do much more, because we can cover a bigger number of genes and get much faster results. And this is
Show us what
outpatient
else you
treatment.
have here.
So this is PET CT scan of the patient who developed a very aggressive form of colon cancer, which spread to the liver. You see white spots, which are liver tumors. She went to the best place in the country. They gave her something like 3 months of life left. And she came to us. We got rid of all of her tumors after about something like 6 months or so. She's now 2 years since we treated her. She's in perfect condition. She does not have any tumors. And this is metastatic colon cancer, for which really there was very little what can be done, okay, with pretty bad involvement of the liver.
Terrible prognosis
Yes.
with
Well,
that.
this is a young lady with ovarian cancer. You can see also PET CT scan. To the left, you can see all of these white spots, which are tumors, which are spread in the abdominal cavity, also in the liver. And then after 9 months, practically everything is gone, okay? And she's alive and doing well. Now it's about also coming something like 2 years since then, okay? And this lady came to us with malignant lymphoma and leukemia. And to the left, you can see PET scan, which shows the dark spots, which are large tumors. They are in the upper part of the body, in the lower part of the body. After about 4 months of treatment, everything cleared up. You don't see any of this. It's not yet cure. It's just remission, and we need to continue the treatment for some time to make sure that we solidify our gain. We get rid of abnormal genes, and the patient is fine. The patient is colon cancer. She does not have any abnormal genes in the system anymore, so she's quite protected.
It's absolutely phenomenal. It's phenomenal.
And it can be done. This is the technology
It
that's
can be done.
available.
It's happening. It's been happening.
Yeah, the patient does not need to be in the hospital.
This isn't a theory.
This is outpatient, and most of the time the patient is taking treatment at home. Okay, so it's an easy thing. It can save $1 trillion a year from medical care costs in the United States, because you don't need hospital beds, we don't need all of these sophisticated things which are done in the hospital, and the patient is dying anyway, okay?
Yes.
Yeah.
How does this feel for you?
I am frustrated because I'm doing this for so many years, and I am trying to change beef eaters to angels. I'm trying to change beef eating good oncologists to angels. It's very difficult, but now I can see something like maybe 2 conversions per month, okay? So it's happening, okay?
Well, the mass consciousness will catch
That's
on
right.
to this.
That's right.
People are
That's
going to
right.
be requesting.
That's right. They're afraid to do anything which can really help these people. They're so entrenched with the standard, which really is not helping much because the standard is already too old. Okay, it was good 50 years ago, not anymore. Okay, everything is changing. But the thing which is developing now, probably most of these doctors will be replaced by artificial intelligence in the years to come, because they don't do much. They simply follow the orders from Washington. So for that purpose, you may need to have simply very good computers, and they will do even better job. Okay.
I'm thrilled to hear that you're behind the wheel on this type of research, because you are helping to steward this in a different direction, which is greatly, greatly needed.